is made up of 3 different types of cells. They include red blood cells, white blood cells, and platelets. One important role of our blood is to transport oxygen to cells and tissues throughout the body. More specifically, the red blood cells within our blood perform this function. Red blood cells contain hemoglobin, a red protein which gives blood its color and ability to transport oxygen. When we breathe in, oxygen is attached to the hemoglobin in the red blood cell and is transported throughout the body to the different cells and tissues that need the oxygen. Anemia is a condition in which there are not enough red blood cells in a person's circulation, or the red blood cells that a person has are dysfunctional. Not having enough or having dysfunctional red blood cells both lead to an inability for the red blood cells to adequately supply the body's cells and tissues with oxygen. There are different types of anemia. One type is called aplastic anemia. In this type, the body does not make enough red blood cells. There is also iron deficiency anemia, which has too little iron in the body. Sickle cell anemia, in which the red blood cells become misshapen and break down. Thalassemia anemia, in which the body has less than normal amounts of hemoglobin. And vitamin deficiency anemia, in which a lack of vitamin B12 or folate is occurring, which affects the body's production of red blood cells. Some objectives for a community with limited resources include having a healthier diet, noticing early symptoms and signs of anemia, and having annual screenings.
Prevalence in the United States. Anemia is the most common blood disorder. According to the National Heart, Lung, and Blood Institute, it affects more than 3 million Americans. Am I at risk for anemia? Many people are at risk because of poor diet, intestinal disorders, chronic diseases, infections, and other conditions. Women who are menstruating or pregnant and people with chronic medical conditions are most at risk for this disease. Also, the risk of anemia increases as people grow older. The prevalence of anemia increases substantially over the age of 60 years old. If you have any of the following chronic conditions, you might be at a greater risk for developing anemia: rheumatoid arthritis or other autoimmune disease, kidney disease, cancer, liver disease, thyroid disease, and inflammatory bowel disease such as Crohn's disease or ulcerative colitis.
So symptoms that are commonly seen with anemia are the following, which is fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness or lightheadedness, as well as chest pain, the feeling of like cold hands and feet, and headaches. Anemia risk factors include a diet lacking in certain vitamins and minerals, such as a diet low in iron, vitamin B12, folate, and copper. Another risk factor is intestinal disorders. They affect the absorption of nutrients in the small intestines. Some of these disorders are called Crohn's disease and celiac disease. So even though iron is ingested, you could say orally, by like a vitamin or through food, even though it's ingested, if it cannot be absorbed, then it's not useful for the body. The body cannot use it. The third risk factor is menstruation. So menstruation causes the loss of red blood cells. For instance, some women, when they menstruate, their periods are very heavy, so they are more prone to losing iron because iron is in the blood. Pregnancy, so being pregnant and not taking any multivitamins with folic acid and iron does increase the risk of anemia. As well, chronic conditions such as cancer, kidney failure, or any other chronic conditions can lead to a shortage of red blood cells. So, slow chronic blood loss from a source within the body, such as maybe like a GI bleed or an ulcer, they can deplete the body's store of iron, leading to iron deficiency anemia. So, family history also plays a role in inheriting anemia, such as sickle cell anemia. And finally, age. People over age of 65 are at an increased risk of getting anemia. Preventative measures that should be taken in order to decrease the chances of getting anemia are intaking foods that are rich in iron. Foods that are rich in iron include meats, beans, lentils, iron fortified cereals, dark green leafy vegetables, and dried fruit. Intaking the nutrient folate is also helpful in preventing this disease. Food that is fortified with folate is found in fruits, fruit juices, dark green leafy vegetables, green peas, kidney beans, peanuts, and enriched grain products such as bread, cereal, pasta, and rice. So vitamin B12, which also is helpful in preventing anemia, is usually found in meat and dairy products, and in fortified cereals, and in soy products. Lastly, vitamin C is helpful with the absorption of iron, and foods that are full of vitamin C are fruits, fruit juices, peppers, broccoli, tomatoes, melons, and strawberries.
Available health resources in San Joaquin County. We have listed 3 agencies in the county that will help the community access services for homeless people, disabled people, veterans, low-income individuals. These agencies offer help with healthcare services that are free of cost, and you can get access to food banks, money for groceries, counseling services, and transportation services, and referrals if you need more help. If you are in need of routine testing, any health problems related to nutrition deficiencies or other diseases, you can access these 3 agencies, which are San Joaquin County Public Health Services and the Human Services Agency of San Joaquin County, which include welfare, CalFresh, and medical.
What we learned on anemia. As we know, having anemia is a condition defined by not having enough healthy red blood cells, which means that your organs and other tissues are not getting a normal amount of oxygen. This sounds significant, and it certainly can be, but symptoms of anemia vary depending on the extent of the condition, as well as the type of anemia you have. Heart problems. In anemia, the heart has to work harder than normal to compensate for the lack of hemoglobin-rich red blood cells. It pumps harder in order to make sure oxygen fills blood is moved around the body. This extra work can put a strain on your heart and lead to complications like heart murmur, cardiac hypertrophic, increasing the size of the heart muscle, and heart failure. Issues with pregnancy. In addition, anemia during pregnancy is not uncommon, especially in the second and third trimesters. However, if it is severe and not managed well, it can lead to having a low birth weight baby or preterm birth. It can also increase your baby's risk of having anemia during their infancy. Further, anemia can put you at risk of experiencing blood loss during labor. Many studies show that iron is needed for the brain to develop properly. Having severe iron deficiency anemia in infancy and childhood can lead to mental, cognitive, and motor developmental delays. Healthy People 2020. In the US, the average prevalence of iron deficiency anemia in target groups is infants 1 to 2 years, 6 to 17 per 1,000, teenage girls 1.5%, non-pregnant females or reproductive age 2% to 5%. Factors associated with a high prevalence include prematurity, a low birth weight, Black or Mexican American race, Alaska Native heritage, recent immigration, and poverty. The prevalence among pregnant women is not known. The American Academy of Family Physicians recommended a screening for iron deficiency anemia by obtaining a hemoglobin and/or hematocrit levels in infants aged 6 to 12 months who are living in poverty or who are Black, Native American, or Alaska Native, immigrants from developing countries, preterm and low birth weight infants, and infants whose principal dietary intake is unfortified cow's milk. The American College of Obstetricians and Gynecologists recommended prenatal screening for all women at the earliest prenatal visit and early in the third trimester. They recommend supplementations with at least 50 milligrams elemental iron twice a day in all pregnant women diagnosed with anemia. When to see a healthcare provider. Anemia can be a serious condition, and it is important that you follow your healthcare provider's instructions and recommendations on diet, medication, exercise, and other lifestyle choices to prevent its complications from occurring. If you have been diagnosed with anemia, inform your healthcare provider if you have any new symptoms or are experiencing a significant increase in your existing ones. If you're experiencing a worsening of symptoms like chest pain, trouble breathing, fast or irregular heartbeat, head to the hospital immediately. You may be experiencing heart problems.